because as a young teen, you know what that's like, going through the hormonal parts, knowing all these new things, the boys and it's just a lot. So for you to catch it at that moment and know what they're actually going into is fantastic.
Yes. And then okay, we have a baseline. So then what do those numbers look like after pregnancy? What do those numbers look like in their 20s, in their 30s, in their 40s and 50s? Yes. So then we can get an objective finding, which is a number that we can put to a symptom or a sign. How are you feeling? Oh, I feel great. What are your hormones? Oh, so that looks like what you're feeling, what's normal for you. And then when we enter menopause, or when we stop producing our own, or when we're not making enough, which can start at age 35, okay, then we know what we're needing, or what for us individually helps us feel better, or where we feel better.
And at 35, no one's really catching it, because that's a time where you're building a family, right? You're having babies, you're starting a career, you're barely hitting the goals, right? Hitting all those goals. So and now you're going into these symptoms of premenopause. It's what it's called, right? Menopause. Yes. These are things that as women, I think in the year 2025 that we're in, we're still learning about ourselves, yes. Right? Doctors don't know what to prescribe. They don't know the symptoms. They don't know what we're looking at. So what you're doing is phenomenal. I think that's amazing. The more we know about it ourselves, the better. And the fact that you can recognize it because you are going through it yourself is even better.
Oh, no. We got to be balanced.
Yes. So what is the procedure? How do you balance the hormone? What is it that you do?
First we draw labs, so again, going back to those numbers, and we want to know what your numbers are. It matters. Do you have a uterus? Do you not? In a male, it matters. Has he had a vasectomy or not? So birth control, or what we're doing in that as far as fertility matters in decisions that we make. And then for a woman, we're talking estrogen, progesterone, and testosterone. For a male, we're talking testosterone. And knowing how to supplement to achieve that balance, we start somewhere. Mm-hmm. So I can tell based on symptoms. Again, we just want to confirm with the lab. So we get started at a place, on what's going on. So the conversation I'll have with most women, or males, we start with a series of questions, which are symptoms. Mm-hmm. And, which one are you experiencing? Which one bothers you the most? How is this affecting your life? And from there, if there is weight to lose, so we start with weight loss. Okay. And dependent on age and other factors. Again, why I talk about weight loss and why I stand on a normal BMI is we don't see disease in those ranges. So that's a goal that I have for my patients and myself, is to be in our healthy weight, exactly, no matter how old we are, period.